It's a pleasant day today.
Dr. Omar Nafusi has just led his emergency department through the longest strike in NHS history.
It is tough at the moment, it's hard. There's been a cumulative effect on the senior medical team and the nursing team and the management team in the hospital from the strikes.
These past few weeks might not have been as grim as some had predicted, but the strain on his staff is being felt.
We want to treat patients who come through the front door in a timely manner. We want to give patients a good experience. We want to get back on the elective. We want to get back on the cancer targets. We want to get outpatient appointments back. We want people to come to the NHS and get the service they deserve.
The strikes before Christmas and after New Year have added more than 200,000 appointments and procedures to the waiting list. It's devastating for patients and for hospitals, which had started to make progress on a record 7.6 million long list.
We need our teams to work even harder than they have before and go the extra mile. Sometimes that means extra cost, paying them to work additional hours, additional theatre lists, more clinics. Sometimes it might mean working with the independent sector.
Hospitals have been helped by a mild flu season, which, along with intense planning, has helped to reduce the impact of industrial action. The hospital is obviously very busy, but the pressure doesn't seem as intense as it has on my previous visits, and that's despite this unprecedented industrial action. It's due in part at least to the milder winter, but the warning is things can change very quickly. Patients like Stephen Rogers can have increasingly complex care needs. He has myasthenia gravis, a neuromuscular disease. He's been in and out of hospital 4 times in 4 months.
You've got patients coming into A&E, being moved to beds, and everything just seemed to be manic, and they didn't have time to breathe. So I would say staffing, more staff would probably take pressure off them.
The NHS has weathered the winter storm so far, but it faces a long list of challenges. Removing the uncertainty and instability of more industrial action will help. Ashish, Joshi, Sky News at the Royal Berkshire Hospital in Reading.